what is patient-centered diagnostics. So on my slide, I'm saying these are testing services that are prioritizing the needs and the preference of patients. In some cases, they support the recipient of care throughout the laboratory processes. So it means that as we are developing solutions to improve diagnostic access, we should be thinking about the patient where they are. How the design of all these diagnostics solutions, processes, how are they relating to the patient? Number one, if we are going to achieve this, we want to make sure that the patients or the recipient of care, they have a good understanding in terms of what laboratory services or laboratory testing is all about. What is the purpose and what is expected of them, and what should they expect from the labs, or even if it is a point of care, what should they expect? So that clear communication is very important, so that the patients understand what services are going to be available. So once we make that part clear, we are beginning to empower, we are beginning to put the patient at the center and front. Of course, what is more important is the issue of accessibility. I think this is one of the biggest challenges, not so many options when it comes to our continent. Sometimes people they could be the only solution, but when they get there, maybe the services are not there. So that's the issue of access, and even the distance issues. So is that really addressing the needs and the priorities of the communities? And of course, empowering the patients with information, respecting privacy and dignity. And most importantly, is the results coming back in time. Because a late result sometimes is no longer useful. And sometimes if we don't design around the patient, some patients are not going to stick around to wait for the results. So we need to understand our communities very well, so that even when we are developing solutions to make sure that they get the results, we should be understanding the challenges that they face even getting to the facility. And sometimes in most cases, people come to the facilities, they get tested, but they don't stick around because they're coming from very far, they've got other priorities in their community. So we need to understand all that, then we develop those solutions. Of course, they're getting the patients, even in coming up with the solutions.